graduate degree in environmental resources on surface water pollution. But when I found out about what sand mining is doing in southwestern Wisconsin, I realized it's a surface water issue, a groundwater issue, an air issue, a land management issue, and the issue of the future of everyone living in this part of the world. So I decided to jump in. I took a class at UW-Madison just on how to do health impact assessments with Dr. Jonathan Potts, who has been sitting on IPCC for 15 years studying global climate change, and he was the one teaching the class. So this is one of the things they had us look at in the class. It's a webinar. I took a part of this webinar to show to you guys today because these are experts in the field and this is what they're saying. So you're not getting it from me, you're getting me telling you what they're saying. So this comes from Tom Lillis, and I see his name all over the place. Sometimes he's for frac sand mines, sometimes he's not, sometimes he's from the environment, sometimes he's not. But here, he's talking about what's actually happening. He's admitting that the DNR knows that these things are happening, and they are this. The issues of frac sand mining, citizen concern with potential crystalline silica and acrylamide exposure, management of fugitive dust and stormwater runoff, abandonment of exploratory boreholes. They're digging holes all over and they're not always filling them in, moratoriums at the county and township level, locating mines adjacent to existing contamination sites, impact of high-capacity wells on municipal water supplies and on private wells, not just municipal water supplies, lack of trade association or similar organized group to work with. He's missing one thing here, placing of mines near old folks' homes and schools and places where there are vulnerable populations. Nobody's paying attention to that. That's something I'm going to add. Here's some of the pictures he put up for this presentation that he gave. There is the fugitive silica dust coming off the sand pile. This is runoff water from one of their containment ponds. And you can see here, they're containing the water here, but the sludge and the water is running right over into here, and I bet you they don't have a permit for that. These are pictures from the DNR.
I'll need some more. Want some more?
No. Half.
All right, so just
Half.
a couple minutes, because you didn't know. So it shows the DNR actually has pictures of what these frac sand mines are doing. Looks like a containment wall might have given away and the sludge is moving here, a bunch of erosion. And that's pretty massive. So the Wisconsin Department of Natural Resources knows this stuff is happening. They've got pictures. They've got everything they need to make sure this stuff isn't happening. This is from Dr. Hillary Carpenter from the Minnesota Department of Health, and she talks about the potential health effects of fugitive frac sand dust and water contamination. I don't know how much you guys know here about fugitive silica dust, the amount in the air that hurts you and the size. But from these mines, you're going to have increased levels of dust and crystalline silica in the ambient air. Respirable crystalline silica has been long recognized by OSHA as, and it's right here in the brochure if anybody doesn't have one, as an occupational hazard. You can get silicosis, you can get lung cancer, COPD, renal disease, several diseases of the immune system. I don't know why she doesn't have asthma on there. It's a biggie. And probably some other stuff we don't even know about yet. So NIOSH and OSHA recently issued a health hazard for workers performing operations with frac sand, concerned about exposures of respirable silica that's greater than PM4. When they say PM, it's particle size. 4 is 4 microns. 4 microns and less can cause health effects. 4 microns gets lodged into your lungs. It's like little tiny knives. It can cause silicosis. 2.5 or less can go into your blood vessels and up into your brain and cause stroke. And the EPA does regulate 2.5, PM 2.5. So they're concerned about 2.5 or PM4. Of the 116 airspace samples analyzed, 47 showed exposures greater than the permissible exposure limit. 9% showed exposures 10 or more times the OSHA.
Do you know where the samples were taken?
No, because I took this off a webinar. So at the end, it'll say where this webinar came from, so you can look it up and maybe backtrack. Ambient silica toxicity. There appears to be a low-level risk of contracting silica-related disease from background levels. However, ambient crystalline silica levels can be significantly elevated downwind of peak sources of silica. That's been shown by Dr. Crispin Pierce and his studies around the Enron oil and gas facility in Chippewa Falls. Concerns about increased truck traffic. So when you do an HIA, you're not only just looking at the effects of the fugitive dust, you're looking at quality of life, you're looking at exposure to diesel fumes, you're looking at noise, you're looking at everything that makes the quality of life in a community. Frac sand mining operations, 7 days a week, 24 hours a day, increased dust, noise, accidents, engine exhaust. Emissions from the mining process, blasting, digging equipment, fixed machinery will also increase the amount of stuff in the ambient air. And then there's concerns about water usage. I just heard yesterday, what's that community where their wells are going dry?
Valley Junction.
Valley Junction. There's a mine there, and not very far from it, their wells are going dry. And this mine, how long has the mine been on operation? A year? I don't know. How long? How long has that mine been there?
Only been there about a year.
A year. Okay, so there you go. Wells go dry from mining operations that use water for cleaning the sand. They can use up to 1 million gallons a day. As we heard in the other room, they wanted to take 2 million gallons a day out of the Black River. That's crazy. Sometimes they use flocculants, and those are polyacrylamides that break down the monoacrylamides, which are neurotoxins and carcinogens. They're generally considered safe, but they don't know, and they haven't done any studies, so how can they even make any claims? Other concerns, environmental degradation, adequacy of reclamation efforts, impacts on other industries and tourism. So, we don't know how well they're going to reclaim because they haven't been reclaiming for anything for us to study. And what's the word in on tourism? We don't know that yet either. They came in so fast and so hard and so many that the data's not in. And it came from the Silica Sand Resources Conference. So there, I don't know if you can see it because that brick's in the way, but it's www.d.umn.edu/prc/workshops/ss. You can come to me afterwards if you want this, but I think you can track this down. So now, I just kind of want to talk a little bit about what you would base a health impact assessment on regarding frac sand mines. And we'll look
What
at
our health impact assessment is, like, is it?
that's coming next.
Okay, all
I
right.
just want to talk about why you would do one. It's because you got dust, you got water issues, you got noise, you got community issues. I'll go back to who wrote this. Emmy Wallenberg, she's with UW-Madison, I believe. She wrote this segment. What is health? First you got to think about what is health. Health is just not being free of disease. Health is having the physical, economic, emotional, and social well-being of individuals, families, and communities. It's not just being free of disease. You want to be able to thrive. How can you thrive with trucks running by and dust in your face and your well running dry? That's crazy. So the world would look different if we took into consideration the things I just said when we made decisions based on this. Of course, they don't have mining in here for some reason. I don't know. There should be in there. So what is an HIA? This is the official definition that most of them use. A combination of procedures, methods, tools that systematically judges the potential and sometimes unintended effects of a policy, plan, program, or project. Project would be a frac sand mine. On the health of the population, we know what health means now. It's not just for, not having disease. And the distribution of those effects within the population. Who's getting mostly affected? Is it children? Is it old people? Is it poor people? Health impact assessment identifies appropriate actions to manage those effects, or if you want to keep a mine out, to prevent it to begin with, which would be my preference. There's 6 steps to an HIA. And has everybody got one of these? Because the 6 steps are in here. And you can look at that while we're talking about this. Need one, Kelvin? You're the one that helped me make the brochure. Got one? Everybody got one?
You know all this stuff before?
No.
I didn't read it.
So the first step is screening. Determines the need of an HIA. Well, if you got a frac sand mine coming in, that's the need. You want to prevent that mine from even becoming a mine. So HIA is intended to prevent it. Because once they're in place, it's pretty hard to get them the heck out of there. So is health already at the table? As far as I can see, health is not at the table around any of these frac sand mines from my research. Time, you got to get in before the mine comes in. Added value, I don't really know what that means. Getting decision makers involved, getting the community engaged with decision makers, which a lot of people have tried and they've been completely ignored. So, yeah, so that's really the sticky thing. If your town board doesn't listen to you, if your county supervisors don't listen to you, this is another tool, but it doesn't mean you're actually going to get them to change their decision. And then the resources that you have in order to do this. Scoping, it determines which health impacts to evaluate, methods of analysis, and a work plan. So, this might help you guys understand this. I have some HIAs right here. Here's the one I wrote, and there's two more examples. I don't know, there must be one going around. There's examples of HIAs right here for you guys to kind of take a look at while we talk about it. It looks like they're generally between 20 to 30 pages long. And there's minimum impact elements of practice standards for health impact assessment. Just pass those around and take a look at them. So,
Are any of these online?
I can email them to you. It was part of my class. Some are part of my class and they're not for public distribution. That one's online. I don't know, I don't have everything covered today. I'd have to have a book. So I just tried to bring enough just to get you guys just started. The scoping part, step number 2, looks at what to evaluate. So if you're looking at frac sand mining, what are you going to evaluate? What would you evaluate if you're going to do an HIA in a frac sand mine? What's that?
Air quality.
Air quality. Would you want to do that after the mine's there or before? Okay, so you want to monitor the air. You want to start monitoring here. What about water? Would you want to check groundwater, monitor water, something like that?
Or baseline.
You got to have baselines. People got to check their well water.
You know how long you have to have your baseline? They've got a half-year baseline. My argument is I'm not sure a half year is enough to say
That it wasn't long enough. Kimberly, what holds up in court? 3 years? 1 year?
Well, it depends. The
It
exercise,
depends.
it depends. It depends on who does the study, what their qualifications are, that sort of thing. But all information is good, but some is more valuable than others.
My guess would be go to the DNR, see what they qualify as something that holds up in court, and then use theirs. If they say they monitor for 3 years, monitor for 3 years. Because then you can always say, well, the DNR says 3 years is valid.
It depends on what you're monitoring as well.
Yeah.
Are you looking at quantity or quality?
So those are just physical things. There is community cohesion, there's economics, there's all different things that define a community is what comes in there. Come on, come back to there. Give me a second. So I haven't been touching this. There we go. So look at the HIAs I sent around and you'll see what they have for that step and it'll give you kind of some kind of idea. Then there's the assessment. That provides a profile of existing conditions and evaluation of potential health impact. So, existing conditions. All the well water is there and it's clean and those are the existing conditions. If the frac sand mine comes in, then this could happen. That's part of your assessment. The methods. You do that through a literature review. So it's kind of nice to team up with a university or some researchers or somebody who's made a living doing this so you're not like going crazy trying to be able to do all this. Surveys, you can go out into the community, you can talk to people directly. Focus groups, well, kind of like we're a kind of a focus group here today. Yes?
That he kept mentioning the tar sands up there, the Keystone, and that I think that's the biggest project that in the globe right now.
Yeah, right.
And they kept wondering about the water, how it was. So they used their own scientists, their own geologists, their own people, their own scientists to go ahead and monitor it themselves. And over a 5-year period, they said that there was it was almost the same. But the fish were mutating, no fins on them. The Indians downstream were getting all kinds of cancer. But then they were using their own scientists and their own people to evaluate the water.
So the company was using their own. Yeah. Where in an HIA, the community is finding their own scientists. It's community science. Like Kelvin Rudolfo and Kathleen and Diego there, these are all doctors. And Al Geddic's here, these are all experts. They would be part of your team.
Yeah.
Yes?
Where's the DNR?
The DNR is making it really
Isn't
hard.
this their job?
It is their job,
You know,
but they're not doing their job. To me, my own personal opinion, they're basically a permitting agency. I haven't seen them turn down a frac sand mine yet, or a CAFO, or protect somebody's well water, or anything. So they're there to permit industry to do what they want and externalize their costs onto your body and the environment. So it's up to us. There you go.
And they will work with the company until we get them permitted.
Yeah, and,
Well, there's a lot of good, I know there's a lot of good people in DNR, a lot of environmentalists in there, but they must
yeah.
be stymied by the
they
upper
are
levels.
stymied. I've talked to quite a few of them, and a lot of them have left since Walker came in office because they can't do their job. Old seasoned professionals that really care about the environment, they left. They're like, we can't do our work. So, Kathy?
Even if they did an assessment, which a lot of times you can't get them to do, if they find health risks, that is not a basis for not permitting. They have to give the permit if all the T's are crossed and the I's are dotted. They can identify potential problems, but under no conditions can they not give the permit.
But that's part of the community's work, is those permits can have conditions that anticipate the problems, and so that if a problem exists, then there's a measure of accountability. So, the problem we're seeing is if they're not enforcing the law, but they're also sending out the door permits that are so bad and that there's nothing to enforce.
Basically, permits they come before they have to.
No, I'm talking about like air permits or water permits, and I don't want to hijack this, so, but.
But you just brought something up. An HIA can do more than one thing. You don't only give it to your township board and your county board and your legislator and the DNR, you also use it in your community, come up with a zoning and a strategy to deal with it. I mean, it's a multi-use enterprise here, what this is.
Has that already been done then?
I don't know.
What you just got done saying? This fire already started.
If I was in charge of it, yes. I don't know how much. In here it shows where they've been done all over the country. I haven't had the chance to research how each one of those ended up, or whether they changed policy or not, or whether they stopped it or not, but they're being done. So that would be another, 20 hours of research for me. But you can leave me your email, and I'll see what I can find out.
I don't think you can make it multi-purpose. I mean, the specifications are, we're pretty much forced you to focus in on
Can they
whatever.
stop this one that's coming? That's what I'm saying.
I just mean as a reference document for the community to really recognize what it is that's at stake. You're not going to actually use it for a document, just as a reference. What do you think about that, Al? Could it be like a reference for what's at stake?
I mean, part of this is educating the people that will be directly affected by the project about the impacts that are not going to be addressed in the official administrative proceedings.
Right.
So it's a political organizing tool to get people actively involved in watching how the decision, or if the decision is being made.
Right.
And in communities where the community is involved at the very beginning of the process, the likelihood of the project being stopped is a much greater possibility than at a later stage in the process.
Right. So if 20 people affected by a frac sand mine read an HIA about the potential effects of it before the frac sand mine came in, like you said, maybe there'd be more organizing, maybe they would be more prepared. So
There's a term in the mining industry called social acceptance. And the industry recognizes that if the state or the local jurisdiction gives a permit, but it doesn't have the support of the people, and in other words, it doesn't have the social, acceptance factor, it's not a viable project, because that project is going to be disrupted, it's going to be challenged, and it's going to cost the applicant, it's going to cost the company money, and the investors are not going to want to put their money in an uncertain venture that won't return anything for 10 years.
okay, all right. So going back to what you said, how effective they are, I think it can be used as a way to dismantle social acceptance of the project. That'd be one way to use it.
They have that keystone, that pipestone coming all the way down to, even through Texas, where this your 73-year-old woman, she was arrested on her own, trespassing on her own land.
Yeah.
And that lady, the other lady that was arrested with her was that Daryl Hannah.
Uh-huh.
And she was arrested with that lady, and now she was arrested again in Washington also now for protesting
Right.
Keystone.
Right.
I mean, what can the people in the community, stop it?
Numbers. If for every one of those old women there was 1,000 people backing her up, but we probably should. Has anybody else got something to say before we get through the
Well,
next three steps?
the importance of the HIA is that if we had one before this thing started, we were in a different position. But because we didn't have that, then we can prove that this was a bad idea, and it is a bad idea, and it's contaminating everything. That's the reason why we are here. If we had an HIA before, this was not happening, because we didn't. Here we are.
But there is a lot of existing data. I mean, there are well samples, and the DNR is improperly using ambient air quality from before sand mining as the background. So there is existing data. I mean, I think just because you didn't start before doesn't mean.
Well, that could be part of the meta-analysis, which is part of the HIA.
I guess the other thing too is being a Whitcomb tribal member, maybe work with the tribe and try to get people they're all getting their wells tested now. That could be part of the president. And basically, I know they're going to be trying to get all these, pretty much every spot in this southwestern Wisconsin is going to be crack sand somewhere. He's going to try to line. Maybe just not even using that as a basis too for trying to put the word out there, letting people know that are native even. To basically say, hey, this is what my water quality was before. And then if the HIA, I'd like to see the HIA done by the tribe. And basically that would even help try to stop the mines. Quite enough. We've already got 2 tribal members, families that don't have water already. And they're both in coma. So, and we definitely gotta do something about this.
I just want to reiterate that Governor Walker and DHS turned down Senator Schilling. They know that this is going to be powerful. That's why they haven't allowed one to happen in Wisconsin.
I came from Oklahoma, and they had coal mining down there. The last 3 years, I've contracted tumors in my throat. Drinking the water in this little town that they've shut down. And it's sinking in and making marshlands. And they bought this town out. It's called a Superfund site. Lead poisoning. They flush this little town where I live in every week. They go in and open up every, what do you call them things, a fire guy goes in there.
Hydrants?
Fire hydrants. They open up these fire hydrants once a week all over this little town and flush this water tower. And it fills back up. My best friend is getting tumors on her tongue. I got tumors in my throat. I came back to my tribe to get help. I don't think that my tribe should have to pay for all this medical help when it was that company, that people that did it. All them people died in the 20s and 30s from lung disease from mining that coal. They brought that chat up on top of the land and made lead. They're selling this lead now out to the states. These states know this is going on. These governors know this is going on. These representatives know this is going on. This is lead-based highways we are driving on out here. When we get out and walk into a rest area, y'all think about that. When you get out in a rest area and walk up there, you're walking on lead-based concrete. You're getting it in you. You don't realize that. You got a dog that you got out, your pet walking out there in that grass. Underneath that turf is lead-based dirt. It's coming from that concrete that they're making. They use this to base that. It's coming through your water. It's coming through the air down there. And I don't think my tribe should have to pay for my.
Shouldn't have to.
So I'm looking forward to surgery radiation, chemo, because of something down there that they wanted to go out here. It's energy efficient, coal, no. That ain't right. That's why I'm here to see what this is about. If I can stand up and make one person see,
Take deep breath.
Bill,
hey, Tom.
you should have her come and talk to the tribe if you're trying to do that. Nathan and I found her in the hotel this morning. She didn't know about this event. Nathan invited her here.